My great pleasure to introduce Jens van Roey, who's the Director of Global Clinical Development at Janssen. He is a medical doctor with a great variety of experience. For instance, he's been medical coordinator of MSF teams both in Thailand and in Zimbabwe. He's worked as a general practitioner in Congo in rehabilitation of people with disabilities in Kikwit. He was an advisor for the National AIDS Control Program in both Burundi and Namibia, has worked with UN AIDS in Geneva, and he was a major player in GIPA, the greater involvement of people living affected with HIV and AIDS, and also has had a large role in developing microbicides. So with that introduction, I'll hand over to Jens. Thank you.
Thank you very much, and good afternoon. It reminds me my work with MSF, that's 30 years ago, but nice. Before starting the official presentation, and I guess this is to move the slides here, I wanted to just reflect a little bit on the traffic light proposal this morning. I'm standing here as a representative of Big Pharma because today I work with Janssen and Johnson & Johnson, which is Big Pharma. Like we had this morning a session of presentation of MSD. And I leave it up to you and to many others to make this sensitive decision. Is this green? Is this amber? Is this red? And I can, with my, as you have heard, my background, 20 years I lived on the ground working as a medical doctor, I struggle often myself. So I'm not going to tell you where I put, which color I would put forward, but definitely it's a different subject. Having said that, my presentation, I'm going to bring a little bit an overview, and I will do it quickly, what Janssen is contributing in terms of partnerships for the developing world, as we used to call it. Afterwards, in the discussion, I will be more available to give my personal view on some of these partnerships, because I've been instrumental in at least 2 of them and involved from the very start. So Janssen Global Public Health is a new department at Johnson & Johnson that was a little bit created to answer a request from employees. Employees that feel in their surroundings, in their families, in their own communities, and in the international press, in the media, a lot of negative criticism on the pharma. And still, these are individuals that have their own emotions, that have their own interest, scientific interest, and want to work on certain diseases and want to contribute. But it's not always feasible in a commercial setting. There were these channels, CSR, corporate social responsibility, philanthropy, but that was not what is needed. That is not the model where you help, where you construct. And Global Public Health Department, it's now almost 2 years, I think, that we exist, was sort of a thinking, can we do it differently? And so that's to compare it, to pit it against existing CSR and philanthropy programs. Now, what are we doing? There's sort of 3 pillars. There is the R&D and the access, which are, let's say, what we do, and the collaboration is how we do. And then you can see vision and mission, but that is all I would call theory. You have to see the acts on the ground. Well, on the R&D side, given the Janssen legacy in infectious disease, especially HIV and TB and tropical diseases, indeed we have some focus areas, because that's where we are home players. We have a program on MDR-TB. We are working on neglected tropical diseases. in terms of developing new compounds, new tools to fight against these diseases. And we work on HIV prevention, and I will come back to that one later. The second pillar is this access, and there we definitely struggle in making sure that our products are equally and not equally available, but also at the same very start of a program, when they become available in the north, that at the same time they should be available in the south. So we are working in partnership with other groups on how can we address this, and I will give examples of that later. And we also working together on innovative models for very specific diseases, especially MDR-TB, where the quality of the service is critical to preserve the value of certain drugs. Otherwise, they become no longer usable because of resistance. And now, the how is collaborating. Janssen is a pharmaceutical company. It develops drugs. That's the expertise. But Janssen has not necessarily the expertise of doing public health. Has not necessarily the expertise of implementing programs on the ground. It's not their role. You cannot reduce global public health to drugs. Often in the media also, and there to the defense of pharma for once, it is reduced. The pharma is the big devil. Their drugs are too expensive. But even if the drugs were, and generics are often accessible, but then if the systems are not there, you still have no health care. So we are sort of trying to collaborate in different areas where we could bring some expertise, and some of these are listed here. So partnership, when you say collaboration, you have to partner. And that's why the model, and that's why also this conference, it was for us worthwhile to come and participate and hear thinking from your side on partnerships. So now I'm going to give a couple of examples. And my personal interest is the first one, is this partnership with the International Partnership for Microbicides, which is on a partnership on the development of a vaginal ring in the prevention of sexual transmission of HIV, in order to bring a female-controlled prevention tool to the field. It's my personal baby, and I'm willing to give how we went through it, how it evolved. I can go into details, how we managed this program to keep it alive within a major big pharma group, where this sort of indication is something that is often sidelined. We, because of our TB, and maybe some of you don't know, but Janssen just has brought a new anti-TB drug to the market that is active on multi-drug resistant strains. And it's the first new TB compound in 40 years or more. So we are pretty proud on that. But we go beyond bringing this product to the market. We have been, and we are partnering with, among others, Harvard Medical School, and with the Global Drug Facility and the Stop TB Alliance and the Stop TB Partnership in not only making the drug, the logistics, the distribution process. So we are not distributing. We have sort of partnered with these organizations, and the drugs cannot be accessed from us. They can only be accessed through these channels. So we want to have this private sector element out of the way in order to advance the program. And the collaboration with Harvard is more on what is now, if you have a new drug, if it's wrongly used in the field, you create resistance. How can we work around that to make sure that the product is correctly used? That's the other partnership. And then in a broader range, we do work with Grameen Foundation and with a couple of research institutes in India on developing platforms for disease management based on cell phone and applications and other things. We have in pediatrics, yeah, any drug, big pharma, they need to have something with children. MSD had it this morning also. That is, we do collaborate with a lot of organizations, and especially with the Elizabeth Glaser Foundation on HIV treatment for children, and do particular efforts for development of around compounds that they are available for pediatrics, because there is no market for that in the north, luckily, but the reality is that in the north, no children is to be born with HIV, whereas in the south it still unfortunately happens. This all should show that we realize and we are well aware that we can't do it alone. We have to do it with others. Collaboration, partnership is key for this new department, for this group. And I would like to end here and invite you in the overall discussion to any sort of questions you may have. How in a big corporate institution, how can you bring in collaboration with groups, and how do you manage it, and what are the issues? But that will then be more a personal point of view, whereas this was more a corporate presentation. Thank you.
Okay, any quick questions of clarification? Yep, one up there, please.
Thank you. My name is Philomena Morike. My question is, do you have strategies in place to ensure the services get to the end user, since you are into partnership with other bodies? So do you have a strategy to ensure that the end user gets the services, like the drugs and others?
Yeah, hello, yeah. Definitely, in the example of the IPM, the microbicide partnership, the license and the agreement that we have signed with them was that they have the full responsibility from early development until market penetration and making sure that the end user can get it. And we as a company provide our wide expertise to help them in getting there. So the end user, or let's say the beneficiary at the end of the story, is certainly part of the picture. Yes.
Okay, great. Thank you very much. So